Utah has been through a pandemic before. The 1918 Spanish flu swept through the state, lasting more than a year, killing 2,900 Utahns.
Fox 13's Ben Winslow joining us live on Utah's Capitol Hill to show us how the lessons learned during that time are influencing Utah today. Ben?
Historians and health officials look back on the 1918 influenza pandemic and see a lot of similarities with COVID-19 today. Take a look at these headlines from Utah newspapers back in 1918. Does it seem familiar?
This is just flu, no worry, things will work out. It then turns to, oh no, this is something entirely different.
The Spanish flu hit Utah around October 1918 and stayed until spring of 1920, killing 2,900 and sickening nearly 92,000. State historian Brad Westwood says there are a lot of similarities between then and now.
Immediately, those medical officers said, no more church, no more organizations. Let's not have any more group meetings.
State Health Commissioner Dr. Theodore Beatty shut down businesses, but things started reopening around November 1918.
It's Christmas time, and the business interests are saying, look, we can't keep this going like this. And so he bends to pressure. At the same time, Salt Lake commissioners and the Salt Lake Board of Health go against the state officer.
Face masks were a controversial topic then, as they are now. There were even supply shortages.
They had a run on a Vicks Vapor Rub because the idea is that you put Vicks Vapor Rub on, it'll help you.
All of this has informed state health officials today.
Things like closing down bars and restaurants was done in 1918. And what we've learned from that is what we're experiencing here is once you open things up, people don't want to go back to more restrictions, so we have to be very careful.
The state faced a spike in flu cases back in 1918 when crowds gathered as World War I ended.
And that's something we took into consideration when we were creating our guidelines for the summer, when we were talking about 4th of July parades and Pioneer Day parades.
State epidemiologist Dr. Angela Dunn says the last pandemic does help to guide how they handle this one.
I think the main thing that we're looking forward in the future to is access to medical care and making sure that we have a hospital bed and adequate care for everybody. And it was similar back in 1918.
And if you're interested in learning more about the 1918 pandemic, Utah's Division of History is posting personal essays and historical accounts. We've got a link to it at fox13now.com. Live on the Hill, Ben Winslow, Fox 13 News, Utah.